It's a go. The FDA advisory panel recommending Pfizer's COVID-19 vaccine for elementary school kids. This decision comes after an all-day meeting that weighed the risks and the benefits.
Fox 6's Derica Williams joins us live with details on what's next and when kids ages 5 to 11 could get their shots.
Well, the panel backed emergency use of Pfizer's COVID-19 vaccine for kids with a unanimous vote and 1 abstention. Now, this is some pretty major news. If they get the green light from the CDC next week, that means that shots could be here by the end of next week at pharmacies, at pediatricians' office, and that's something many parents are eager for.
We'll be first in line to get our children and our community protected.
Dr. Ben Weston shared why he trusted Pfizer's COVID-19 vaccine for children ages 5 to 11.
Some of the most studied drugs in history. There's nothing experimental anymore about the vaccines. So parents should feel very confident getting this vaccine for their child. I know that I will.
The FDA advisory panel spent all day weighing the benefits and risks, and public comment was also given. While there was support shown, skeptics also spoke up with concerns about adverse effects. Dr. William Hartman, the principal investigator for the UW Moderna pediatric COVID-19 vaccine trial, says while the research shows predictable symptoms from the Pfizer shot, the panel looked into all potential issues.
The inflammation around the heart that has been associated with these vaccines. And so they're looking very closely at that data to make sure that the benefits of the vaccine outweigh the risks of developing myocarditis.
The data that Pfizer submitted shows its vaccine, which would be administered to children at 1/3 of the adult dosage, is nearly 91% effective, a great percentage that Dr. Hartman says can make a difference as the Delta variant continues to spread.
The kids themselves, while they are at less risk of developing severe disease and being hospitalized for COVID-19, in this age group, almost 2 million kids in the U.S. have been infected with COVID, and almost 9,000 of them have been hospitalized, with 1/3 of those going into the ICU.
So, of course, many folks are hoping those shots get delivered and distributed pretty soon. Today's decision now awaits the FDA approval, and then it goes to the CDC's independent advisory panel, who will deliberate and vote next week on November 2nd and 3rd. Milwaukee County says they are already working with MPS and healthcare providers for this rollout, even with some incentives. Reporting live in Brown Deer, Derica Williams, Fox 6 News.
Derica, thank you.